Hi everyone, this is Alice, one of the pediatric pharmacists at the Johns Hopkins CF Clinic. Today I'm here to do episode 2 of our Ask the Expert series where I'll be answering 3 frequent questions that I get in clinic. The first question is, how do I make medication taste better so that my child or teenager will actually take it? Second question is, why can I not take vitamins and dairy products with ciprofloxacin, which is a common antibiotic? And then third question is, what exactly is a Seville orange and why can I not take it with my CFTR modulator? So the first question of the day is how to mask the flavor of certain medications in order to improve palatability and help your child take the medication if they're unable to tolerate it. So one of the things you can do to make medication taste a little bit better is to put it in the refrigerator. So things such as the CF vitamins and antibiotic suspensions or solutions tend to taste a little bit better when they're cold. So putting them in the refrigerator is an option. The other thing you can do is use popsicles or ice cubes to numb the tongue prior to their dose of medication. This tends to make the tongue less sensitive to medications that don't taste so good. So if your child has a favorite popsicle, then giving them that prior to their dose of medication is worth a try. The other thing that seems to work for some patients is to coat the tongue with more common items such as peanut butter or pancake syrup or chocolate syrup, and that way the tongue is already coated with something that's more viscous and has a potent flavor, so when they do take the medication it's not so potent or aggravating to their tongue and senses. And finally, another thing that is worth a try is to crush the medication and put it in a soft food or liquid that they like. So if they like ice cream or Kool-Aid, those are very potent foods that have strong flavors that can be utilized to mask the flavor and taste of medications that don't taste so good. Always double check with your doctor and or pharmacist to see if the things you're mixing in are okay, because there are a few drug interactions that should be avoided. Our second question of the day is, why can I not take dairy products or my multivitamin with ciprofloxacin? As many of you all know, we commonly prescribe ciprofloxacin in the outpatient setting to treat a bug known as Pseudomonas, which is very common in CF patients. So ciprofloxacin can be given as a tablet, or it can also be given as a liquid suspension for our patients that don't swallow tablets. The reason that you should not take your vitamin or any dairy product with the ciprofloxacin is because there is a very significant drug interaction where if you do take these together, it can bind to the ciprofloxacin drug in your body and make it 90% ineffective. So in other words, if you take, say, your Decas Plus vitamin with your dose of ciprofloxacin, then your ciprofloxacin will not be able to do its job and kill the bacteria that we want it to, because it's physically bound to the minerals in your vitamin. So all of these products, orange juice, milk, yogurt, vitamins such as your CF vitamins, those all have a ton of minerals in them, such as zinc, iron, calcium, and magnesium that have this drug interaction with ciprofloxacin. So if you are on these multivitamins or you frequently drink and eat dairy products, then it's best to take the ciprofloxacin 2 hours before your dose of cipro, or wait 4 to 6 hours after you've taken the cipro to take your vitamin or eat and drink other dairy products. So our final question of the day is, what is a Seville orange and why can I not take it with my CFTR modulator? So I did not know what a Seville orange was until I did some research, but it's also known as a bitter orange. So it has a very tangy and bitter taste. So much that it's rarely ever eaten as just a fruit by itself. It's normally used to make marmalade, such as the one shown here, or in pies and cakes that have more of a tangy orange flavor. So a lot of our patients have heard me talk about Seville oranges and grapefruit juice when we talk about the modulators such as Trikafta and Orkambi, Kalydeco, and Symdeco. And the reason that patients on CFTR modulators should avoid these specific fruits is because there's actually a drug interaction where the Seville orange and the grapefruit juices can inhibit one of the enzymes in your liver that is primarily used to metabolize and process the modulator through your body. So in other words, if you take a modulator and you eat Seville orange marmalade or drink a lot of grapefruit juice, then your modulator is not getting metabolized appropriately and more drug may be in your system than we want to be. So there you have it, Seville oranges from Spain. You should avoid marmalades like this one, also grapefruits and grapefruit juice, but other oranges are okay.